I have a little bit of a different perspective. I'm an internal medicine hospitalist, and I'm the Chief Medical Officer at Northern Inyo Hospital. So I don't take care of children, I take care of adults. And this past winter was really rough. I took care of a lot of our community members in the hospital. And when we have COVID patients in the hospital and they're already sick, I don't have effective treatments. We try a lot of medications, dexamethasone, remdesivir, ivermectin, high-dose vitamin C, but none of them have been proven to help. So when we have a disease where we don't have treatment, what I do as a physician is I focus on prevention. So it's not unlike stroke, which is something else that I treat. When a stroke happens, there's not a whole lot of treatment. So all of our focus is on prevention. It's the same with COVID. When somebody comes into the hospital and they're sick enough to be in the hospital, my hands are fairly tied. I support patients with oxygen and with some medicines that I'm not sure are going to work. And I've had to watch our community members die this past winter. And so what I just encourage everyone to do is do everything that we can to prevent this disease and prevent from getting this disease. I know everyone has their opinions. I'm not here to force anyone to believe anything. That's just my standpoint from being a physician and an adult hospital-based physician and seeing what we saw this past winter. Thank you.
Hello, everybody. Thank you for being here. My name's Anna Scott. I'm the Public Health Director for Inyo County. And I'm here to just talk a little bit about what we've been seeing locally in our case rates over the past month. We have, as this Delta variant has started to has spread throughout California, we're starting to see an increase in cases here as well. Typically, what we've seen throughout this coronavirus is that we'll start to see spikes in other parts of the state or other parts of the country that are more populated. Inyo County tends to be a little bit behind that curve, so it was a little bit later for us. The state started really sending out warning a few weeks before we really started to see it hit here. But we have seen exponential increases in our case rate. Now, we're not where we were at yet, where we were at in December, where we saw our highest case rates, but we're rapidly increasing. And part of our concern really for the children that are going to be going back to school, as our Northern Inyo Hospital colleagues already pointed out, this virus variant, the Delta variant, is much more transmissible, it's more contagious, it spreads very quickly. And so what we've seen is that a huge increase in cases very rapidly throughout the country. Having a masking requirement in the schools can help reduce that transmission rate. And what we really want to see is the kids in the school and not being quarantined as frequently as they were last year. We want to have them attending classroom studies rather than being at home learning online. So we're really very much supportive of getting the kids back into school safely and helping to reduce the likelihood that we'll have kids getting sick. One other thing I wanted to point out, and this is, I admit, a worst case scenario, but it is something that we're concerned about and something that we're planning for, and that is if the person who's infected is wearing a face covering and the person next to them, it increases the likelihood that that person who is not infected will not become infected. I didn't bring all of my statistics with me about how effective that is. But it does reduce that risk. What I wanted to point out is that we do not have pediatric ICU beds in Inyo County. In fact, we have very, very few pediatric ICU beds in the state of California, just a few hundred. And if we start seeing kids like we saw last winter with multiple people that were in the ICU, we were doing transports all over the place to put people in appropriate level of care. If we need to start doing that with kids, our options for that are much, much less. And so what that means is that we'll have to treat severe COVID in children where we don't have the specialty to do that, nor do we have all of the equipment that's necessary for that. So that's another piece that's really driving our preparedness and our concerns for that. Should I take questions? Do we have a test? There, I'm sorry? Okay. So the question is there a test for the Delta variant? So the rapid testing that we're doing, and most of the testing is to identify coronavirus. There are reflexive tests to, well, there is gene sequencing that will identify the variant, and that's not being done on every single test. Okay, I think we're going to public comment now? Okay.
Several people at a time, so Lori Gillum and then Cindy Weinbach, sorry, thank you, I need to change my glasses, and Jessica Sharkey, please.
It doesn't matter. Okay. I hope introducing myself isn't part of my 2 minutes because that wasn't calculated into this. So anyhow, I'm Lori Gillum. I am a parent here at the Bishop School System. I'm here to speak to you tonight as a member of what a local social justice advocacy group has called the loud, misguided minority. However, based on the people here tonight, I don't think I'm a minority. I have a junior that will be enrolled at BUHS this year. I also have just graduated a senior. And I have been, like many of you, busy raising my family. I have been trying to take care of their emotional and physical well-being, and I haven't had time to come to all the board meetings and be involved in all the things in this community, and shame on me for that, because apparently there have been a lot of people here that do not have our kids' best interests at heart, and that needs to stop now. We need to show up. We're a year and a half into the pandemic. 511 days after the initial 15 days to slow the spread. And despite a lot of data, there's data both ways, data saying masks are great, data saying they don't work at all, even in laboratory settings. It's absolutely crazy to me that we're actually considering sending our kids back to school in masks. It's been tried, it's done, people still get sick, but here we are. You, the board members, have been provided a stack of studies and information by Mr. Brian Winsenreed. I'm pretty sure none of you have had a chance to review or read any of it, but there's a lot of really good information in here. A really important thing is kids are not at a high risk for this COVID-19. 99.9942% of kids that contract COVID survive, and that's from California Department of Public Health published data. As a parent, it's...
Can I give her like a minute and a half of my time? No.
Okay. So our children are not responsible for protecting the health of those in the high-risk group for COVID. Every family member should be able to make their own independent determination of what is right and what is best for their circumstances, and mask wearing should be a personal choice. My boys wore masks all last year, and it was detrimental to their social and emotional well-being. It was a distraction in class. It increased their distraction, which if you have teenage boys, that's not a good idea. And it made them depressed. And our children's mental health is important. It's really important. And I don't know anyone who will disregard the data as far as increased suicides, drug and alcohol abuse, and depression in our kids over the past 18 months. It's a huge issue. And these COVID restrictions are going to continue indefinitely until we all decide to no longer comply with unreasonable government mandates. Thank you.